Hello and welcome to this very short discussion on the hyoid bone. So the hyoid bone is not actually going to be a bone of the skull, and it's going to be this U-shaped bone here that is located in front of the neck between the mandible and the larynx at the level of the third cervical vertebra. Right. And this bone is unique in the sense that it does not articulate with any other bone in the body. Or it has a muscle attachments and ligament attachments. Right. So it's suspended from the styloid process by stylohyoid ligaments, for example. Right. So as I said, it's going to be a U-shaped bone. It's situated in the anterior midline of the neck between the chin and the thyroid cartilage. And at rest, it lies at the level of the third cervical vertebra, behind and the base of the mandible in front that I've already mentioned. And it is kept in position, suspended by muscles and ligaments, right? Particularly the stylohyoid ligaments that are going to be attached to the lateral surface of the styloid process, right? Then it provides attachment to the floor of the mouth and to the tongue above. Then to the larynx below, as you look at the larynx, it's also going to be attached to the hyoid. Then the epiglottis and the pharynx behind as well. Right. And it consists of a central part called the body and two pairs of conua, a greater and a lesser conua, which are going to have different embryological origins. Right. So this is the body, that is the lesser conua, then those are the greater conua. Right. From this depiction, you can notice that it is actually a U-shaped bone. So the body, it is anterior and posterior surfaces, as well as upper and lower borders. Right. The anterior surface is convex and is directed forwards and upwards. You can try to remember the clavicle, how it is going to be divided into a medial 2/3 and a lateral third. The lateral third was concave forward, right, and was convex backward. Then if you look at the medial 2/3, it's going to be the reverse. So if you look at the anterior surface of the body of the hyoid bone, it's convex. The posterior surface, it's concave. And this one is directed backwards and downwards, right? Then each lateral end is continuous posteriorly with the greater horn or the conua, right? And till middle life, the connection between the body and the greater conua is actually going to be fibrous, right? Then this greater conua, they also have surfaces, an upper surface and the lower surface. They're going to have borders, a medial and the lateral border, as well as a tubercle, right? Then if you look at the lesser conua, they're going to have, in terms of size, they're going to be actually smaller, hence lesser, and they're connected to the body by fibrous tissue. And occasionally they may be found attached to the greater conua, right? Not the body. And that attachment will actually occur through synovial joints, which usually persist throughout life, but may get ankylosed, right? So that is the tubercle of the greater conua. Those are the surfaces. That's the medial border, that's your lateral border, that's the body, that's the lesser conua. If you look at the body, that's a transverse ridge. You have a median ridge as well in this case here, right? Then that's an anterior view. Remember I said that the body anteriorly it's convex, but if you look at it posteriorly, it's going to be concave, right? Then in terms of attachments, there's the suprahyoid and infrahyoid muscle groups, as well as the hyoglossus muscle and the thyrohyoid membrane, part of the larynx. So on the anterior surface, there's insertion for the geniohyoid and the mylohyoid muscles. The geniohyoid muscle will actually originate from the inferior genital tubercle on the mandible. And this anterior surface will give origin to the hyoglossus muscle, right? In terms of the body. Then the upper border of the body provides insertion to the lowest fibers of the genioglossus and attachment to the thyrohyoid membrane, part of the larynx. Then the lower border of the body provides attachment to the pretracheal fascia, which will be one of the 3 deep fascias that you're going to find in the neck. Right? You also find the stenohyoid inserting there and the omohyoid. The omohyoid inserts laterally, whilst the stenohyoid inserts medially. If you look at the omohyoid, you'll best remember that it was actually going to have two heads, right? And one of those heads was going to come from the suprascapular notch that you found on the upper border of the scapula, particularly originating from the ligament that closes off the notch to become a foramen. Right. Then the medial border of the greater cornu provides attachment to the thyroid membrane as well, the stylohyoid muscle, and the digastric pulley, which is simply the tendon that joins the anterior belly and the posterior belly of the digastric muscles. Then the lateral border of the greater cornu provides insertion to the thyroid muscle anteriorly, as well as the investing fascia, which is also the other deep cervical fascia that you find in the neck. So I've already mentioned the pretracheal fascia on the lower border of the body. Right. Then this is also another depiction. So that's your hyoid bone. You're going to describe the hyoid bone when you talk about the triangles of the neck. Right. Then this is a diagram or a depiction of what I was describing. You can look at it and look at the respective muscles that I just mentioned as they attach onto the bone. This is the same story, but the previous one was more clear and had more illustrations. That is the same story, right? Then clinically, in a suspected case of murder, fracture of the hyoid bone strongly indicates throating and strangulation. So that can be used in forensics to look at the way someone actually died. Right. And also the tip of the greater cornu can be palpated in the relaxed neck near the anterior border of the sternocleidomastoid. And the lingual artery forms a loop above the greater cornu, hence is an important surgical landmark for locating the lingual artery for ligation if you're having a surgery in that region. So that's just about it. Pleasant viewing.